Endometriosis is often framed as a physical condition. Although the physical impact on the body is major, it can also have a huge impact mentally. A study by the National Library of Medicine reported an increased risk of developing clinically recognised depression and anxiety for patients with endometriosis compared with those without. Here's what some women had to say.
It was incredibly stressful. I ended up with severe depression. 2 years ago, I actually had a full mental breakdown. I had to give up my job. I couldn't leave the house. It was just the darkest moment of my life.
6 years ago, I developed OCD-induced anxiety. So I was diagnosed with that, and OCD is debilitating.
It has affected my mental health, and I was on antidepressants for a while because I thought I was depressed, but then I came off them and I realised I wasn't depressed. It was all my physical health was just getting me so down because I wasn't being heard and I wasn't getting any help.
It's, for me, it just gradually got worse and worse and worse, and it did affect my life.
I got really bad depression and I ended up doing my GCSEs from home and just scraped by with them. I didn't really get any support from school. My mum didn't know what to do with me, bless her. My friends didn't understand it. And I remember going to the local mental health service, CAMS, and the counsellor saying to me, "Oh, why are you depressed? What's wrong with you?" And I'm like, "I don't know."
It was awful, and I don't feel like I was a very good partner or a very good mum throughout that period of time. It's kind of a blur.
It was just having the operations all the time, which that took its toll on me, on my relationship, everything really.
It still baffles me with everything I've gone through, going through hysterectomy at 28, having 2 stomas, having all those surgeries. I've never once been offered mental health support or anything, and it's absolutely destroyed my mental health.
The mental toll of endometriosis is not limited to those dealing with the condition. For those supporting loved ones, it can also be a strain on their mental health to support when they feel helpless.
At times when you're trying to help, it kind of, as a man, it affects you in a way that you kind of feel a bit useless because you can't really offer anything of significance. You don't really know, other than maybe suggest taking paracetamol or pain relief, what it is and what it should be, and even a lot of the medical terms. But you just try and offer support and try and just offer practical help where you can.
Mentally, it's just stress related, I suppose. Like, you worry as a mum that your children are okay, and you just want to take the pain away from them, and if you could, you would. I would anyway.